This meeting is being recorded.
So yeah, hi everyone. So we would like to start the webinar.
I'm here.
If you could all please mute your, thank you so much. We would like to start the webinar on the NFM4 and how people who use drugs can mean. I was sorry, I was accidentally muted. My name is Gaia. I work as a program officer at the INPUD, International Network of People Who Use Drugs, and together with Aditya Taslim, the advocacy officer, will be moderating this webinar. So we have a quite packed and very intense agenda for today. We'll have the opening remarks by Judy Chang, the Executive Director of INPUD, followed by the intervention from a Global Fund, our colleagues Gavin Raid and Daniel Wolf from the CRG department, talking about the Global Fund NFM4 and introduction to the process and the timelines. Then we'll pass the floor to Alistair Abdallah, the National Coordinator of Kenya Sex Worker Alliance, to talk about experience and lessons learned on the community engagement in NFM processes, followed by Andy Mulia from PKNI, who will talk about the drug user involvement in the Global Fund NFM process as well. And finally, our final presenter is Adriana Jimenez-Gwen, who will talk about the UNAIDS experience, the UNAIDS role in the process and UNAIDS support to engage people who use drugs. We'll then have a moderated discussion with the speakers, followed and finally by the Q&A from me and Aditya, and have a closing remarks, of course, by Judy. As for the quick, just to recap on the rules, please keep your microphones muted during the presentation. If you would like to speak, then you can, of course, unmute yourself during the Q&A. The meeting will be recorded. If you have any objections, just let us know. If you have any questions, then please do post your questions in the chat box, and we will answer. We'll try to answer most of or all of them in the last part of the session. And for that, please use raise the hand if you would like to ask it orally. And finally, we normally, as a tradition, take a group photo of all the attendees after the webinar, and would like you to ask to switch the camera on. If you don't want that, you can keep the camera off. We have today the translation into 3 languages, Russian, French, and Spanish, which you can see on your webinar controls. So you can click the language that you would like to hear. And if you want to hear only the interpreted language, then you should click the mute original audio, but don't do that during the Q&A if the questions are asked in the original language. So then we'll help with the translation to be provided in the main room. Otherwise, I will now hand over to Judy for the opening remarks. Judy, please welcome.
Thanks, Gaia. Welcome, everyone, and thank you for joining. So INPUD are holding this webinar, and it's part of a series of technical assistance webinars funded under the Global Fund CRG Strategic Initiative. And I think many of you, I've seen many of you on our previous webinars, but really want to emphasize how important this particular webinar is on the NFM4, because it is the next major opportunity that we have as a community of people who use drugs to obtain funding for our priorities. And that's from harm reduction services, being led and delivered by people who use drugs, for advocacy for decriminalization and human rights protection, to funding community-led research and monitoring. So as many of you know, the Global Fund is very important for people who use drugs worldwide, and it's estimated that it makes up 60% of international funding for programming for people who use drugs. So the NFM4 is not only an opportunity to increase funding overall for harm reduction, which we all know is desperately needed, but it's also an opportunity to push for it to be spent and invested better. Because at the end of the day, you know, we know where the money needs to go as a community. And we know at the moment that money is not being put sufficiently towards our priorities. So I think it is the opportunity and it highlights the need to really disrupt, you know, this status quo. But of course, you know, it takes more than just calling this inequity out. You know, we as a community need to find ways to use leverage points and be in the spaces where funding allocations are made that affect our lives and make sure that we're influencing them. And this can be from country dialogues to funding request writing and particularly grant negotiations. So I think, you know, some of you and your networks would have been involved in NFM3 and C19RM. So you'll know how difficult it was to try and push to get community priorities in the funding request. And, you know, majority of the time they were either written out or put in the PAR. So I think, you know, looking at the past, we need to learn how to, you know, take lessons from these experiences and also know, you know, we don't have to do it alone. So of course, on the webinar today, there's a lineup of speakers from the drug user and sex worker community, from the Community Rights and Gender Department, from UNAIDS, who will share lessons from the previous NFM3 and C19RM, but also introduce new elements of NFM4 that are designed to increase the chances for community priorities to be funded, and also share ways that, you know, UN officers can help. So I won't take up more space. There is a great lineup of speakers and we've got a busy agenda, but just really want to reiterate like just how critical NFM4 is. It will, of course, be very technical. We know that it'll be very politicized, but we really can't miss this opportunity, because whether or not we engage effectively in NFM4, you know, it is a matter of whether we get access to life-saving services or not, whether we get human rights or greater human rights protections or not, and, you know, whether our communities are funded or continue to get shut out. So thanks. I'll pass it over to the next speaker.
Thanks so much, Judy. So now I'll pass it on to our colleagues from Global Fund, Gavin Reid, the Community Engagement Lead, and Daniel Wolf, Harm Reduction Advisor at the CRG Department. Gavin, Daniel, welcome.
Thanks so much for the introduction, Gaia and Judy, and we're delighted to be here with you for the next hour and a half. It's a really critical conversation. I don't know if we're able to show any of the slides, but I think what's important, I'm going to start off with a framing around the strategy, then Daniel will talk about some of the changes in the harm reduction guidance. But in relation to the strategy now has communities at the center, and the leadership and participation of communities as one of 3 mutually reinforcing objectives. So community engagement has been elevated in this current strategy. And what's important for you to recognize, if we can go on to the next slide, is that this strategy starts from January next year. So it's a strategy taking us through to 2028, and that will cover the next 2 funding request allocation periods. So next year, there will be funding request allocations, and then there'll be the subsequent one in 2026. If we go on to the next slide. So where we are now is, many of you will know that there was a replenishment conference last week. And we're still waiting for some large donors to announce their allocation, the UK and Italy, but the board will be meeting in November and approving the final application approach and the allocations, which means allocation letters will be sent to CCMs at the beginning of December. And there are 3 announced application windows: the 10th of March, the 29th of May, and the 21st of August. So if we work backwards from those, if we go from window 1, 10th of March probably means country dialogue will start at the beginning of next year or even towards the end of this year. And that's really important in terms of your framing and how you are thinking about NFM4. And I think today's webinar is perfect timing, because now is really the time to start engaging with people who use drugs communities and other communities. So I'm particularly delighted that Felicita's on the call, because I think we're going to have to work across constituencies to build up our business case for NFM4. And let me pass to Daniel, who's going to be talking about some of the technical opportunities.
Thanks. And yeah, if we could go to the next slide. Hello, everyone. Good morning, good afternoon, good evening. I'm Daniel Wolf, and I'm some of you may have known Palani, who was the harm reduction focal point. I'm filling in until the Global Fund replaces him as he stepped away. But I am involved in putting together materials on harm reduction. I just wanted to highlight for you some really important developments in what will be going as technical guidance to country applicants, and what the TRP, the Technical Review Panel, will be looking at when they receive the applications with regard to harm reduction in people who use drugs. Maybe the first thing to know is that there are now something called program essentials at the Global Fund, which means that every applicant, every country, needs to address the status of these in the application, and harm reduction is now regarded as a program essential. So the guidance that the countries will get will say that your application must discuss plans for harm reduction, and that the top priority interventions, because harm reduction means many things to many people, as we know. Some countries spend all their money, for example, just on, say, trying to measure the number of people who use drugs or something with no programming. So the top priority interventions are needle and syringe programming, opioid substitution treatment, and naloxone. However, also some important developments. Historically, people who inject drugs has been the priority, and it remains the priority. But the Global Fund now recognizes that our broader frame, people who use drugs and their sexual partners, is appropriate and useful. So, for example, if your country is proposing work on stimulant harm reduction, work on chemsex, work on rights protection for people who use drugs, not just people who inject drugs, because many people are being arrested or detained or discriminated against when they go to seek healthcare. All of that is recognized as valid programming. There are also human rights program essentials this year. So there are 4 that are particularly prioritized. And again, every country will be asked to describe the status of their plans for these. And if you're in a so-called core or high impact country, you'll be expected to either say who's going to pay for it outside of the Global Fund, or to propose a plan to fully implement these program essentials. And the 4 are integrating human rights protections into HIV and TB services. So not just saying, okay, human rights protections for people who use drugs can be a standalone thing that we fund in a very small amount. That's completely separate, but actually trying to make that part of HIV services. So for example, legal support when you go to get an HIV service if you're someone who uses drugs, removing stigma in healthcare and other settings, advocacy, including community-led advocacy on decriminalization and other policy change. These are all harm reduction and human rights program essentials, and every country should include some discussion of these in the application. One other really important development for this new funding round is a little bit more clarity on hepatitis B and C. Many of you know that the Global Fund has supported hepatitis C treatment for people who are co-infected, for people who inject drugs or people in prisons. The guidance this year clarifies that if it's part of a comprehensive HIV programming response, including, for example, needle and syringe programming and HIV testing and treatment for people who use drugs, that hepatitis B and C treatment and testing will also be supported. So hepatitis C treatment for people who inject drugs who are HIV negative, if it's part of a comprehensive HIV response in the country, and if you can make some epidemiological case, show, for example, that infection is high among people who inject drugs, which it is in virtually every country, then it can be funded. So those are all things that may be new to the countries, and it will be very important for you all to emphasize their importance in those people who are preparing the applications, and for the technical review panel to come back to countries and say, look, we are looking for these things as essential to people who inject drugs, to people who use drugs, and to an effective HIV response. Now back to Gavin.
Thanks, Daniel. And I think an important point to emphasize is that many of the priorities of your priorities are not just your priorities, but are also articulated in the Global Fund strategy, the UNAIDS global strategy, and within the technical guidance. So I think it's important that when we advocate, we are advocating for what is actually included in Global Fund strategy and guidance. If we go to the next slide, what can you be doing now? The first thing is making sure that you've got the relevant information and that you can understand the information. And I would encourage you to have a conversation with Gaia, Judy, Olga, and everyone at INPUD to make sure that you're getting resources that are accessible around understanding a huge array of guidance that's coming from Global Fund. The secondly, it's really to know and engage with partners in country. So make sure that you're connected with your CCM representatives, whether they're key population or civil society representatives, and also be reaching out to other key populations and allies to see how they're organizing and preparing for NFM4. It might seem far away, but the time will go very, very quickly. I would also encourage you to reach out to technical partners, including UNAIDS in country, in order to be able to liaise with them around your priorities and help socialize your priorities. And that involves having an engagement plan, map out the milestones back from when you're likely to submit. And understanding when you're going to be submitting, a lot of CCMs won't formally announce when they're submitting, but discussions are already underway in country, and countries are already considering when they will be submitting. So make sure that through the CCM reps, that the CCM will provide you with a roadmap around how the country dialogue will happen to inform the funding request development, seek support from partners around who is going to be on writing teams or who might be able to be available to represent the interests of people who use drugs and other key populations in that writing team. If you need resources, CCMs have 15% of their budget allocated for constituency engagement. So ask about the resources that they have. And if you need other resources, reach out to us. Again, I would ask you to do it through INPUD so that they can get an overview of what is needed. So, and with that, if there are specific needs in relation to technical assistance, it's important to know really, really early. We're currently going to be closing off technical assistance for window 1 shortly, and we will close off the window for window 2 at the end of November. So we really need to walk quite fast. And I think I really think it's about organizing and being clear on what your priorities are. I know we live our priorities every day, but then thinking through how do we articulate those priorities in line with the Global Fund strategy, the technical guidance, and also getting support to, where possible, cost interventions, so we can be really specific about what we need to happen, where, with whom, and how often and how much. Thanks so much.
Thank you so much, Gavin and Daniel. Really very interesting overview. In the interest of time, I will now then pass to our next speaker, Falister from the Kenya Sex Work Alliance, who will talk about their experience from the perspective of her community and also her country, on how the process went for her and for her people. Please, Falister, welcome. You can unmute yourself.
Thank you so much. As you both heard, I'm Falister Abdallah. I want to share my country experience when we started engaging with the Global Fund. I think first, foremost is, as the sex workers community, we had to understand Global Fund very well. What is Global Fund? Why is it important for us sex workers to know about Global Fund? Why should we get involved in Global Fund processes? And why should we be part and parcel in making decisions when it comes to Global Fund, and even implement and monitor Global Fund? So I think one of the things that we did through the Global Network of Sex Workers is they gave us a lot of knowledge, a lot of training, took us, bring in Global Fund people to talk about the processes. They made us understand the strategies, and even sometimes participate in the strategy meetings. When it came back in country, one of the things that we made sure is to make sure that we have a representative at the CCM. In Kenya, we call it the KCM, the Kenya Coordinating Mechanism. We made sure that we have a key population representative. But in Kenya, we went further to fight and say, since the key population are more, we have the men who have sex with men, we have people who are using drugs, we have transgenders, and we have us sex workers. One of the things that we did most is to make sure that we bargain for more than one seat. So the seats that we have at the KCM are two. So one of them is a gay man, and the other one is a sex worker, so that they can be able to push for our ideas and agendas. And then in Kenya also, we have the Key Population Consortium. As the Key Population, we found a platform where we built trends within ourselves. We made sure all the populations are coming together to bargain for key population issues. So even at the writing time, whatever was being written and went into the application, it is what we had sat down and said, this is what we want. And because the language that they use at the writing level, it's a very technical language. So one of the things that we did is identify a consultant that we paid as a community who was going to push in our language in a technical term that the other team members were talking about. Number two, we also need to be very political, because Global Fund processes are very, very political. So as a community, we also learned on how to become political. Number four, you also have to be a person who knows how to bargain. And when people, it's time for you to make noise, you also make noise for your population. So those are some of the things that we also implemented when it came to Global Fund. In Kenya, the government decided that they were going to send the proposal without the signatures of the key population representatives. The application was sent in. We wrote in a protest letter by saying we do not support the application that was sent. And Global Fund made a very high decision. Our application was actually refused. It was returned back into the country, and they were told until there's inclusion of the key population, that is when they were going to accept the submission of our country concept notes. That was what was done. So the government had to call us again and ask us what we wanted. And we made sure that each and everything that we had worked for had been put within the proposal. But one of the things that we did best is mentioning, because we knew when it came to people bargaining to become SRs or to implement, it was going to be very complicated for us as a community because of our capacities. So one of the things we did is in the writing, we became very clear. We are going to have 5 sex workers-led networks trained in capacity building, but after the capacity building, these groups are going to be implementing the global fund. So that is how we got the sex workers MSMs-led organizations to implement global fund. So it means for you to be able to benefit and your issues to be heard, it needs to come out clearly from the writing time. It has to be very clearly from the time that you're negotiating. When the proposal came back, we had found out that the concept note was returned by the Global Fund. We found out that some of our issues were actually removed. So we made sure that we returned all the issues that we had said we wanted to be done in sex workers, and those things, all of them were returned, and we had an agreement, and they were actually set. Another thing is there is power in the CCMs. If our representative does not make a vote, it means nothing is going to take place. As a community, we need to understand where our powers are. The people that we have voted in, how do we make sure that when they are going to for those meetings, they are actually pushing for our agendas? They are actually speaking the language that we agreed as a team they were going to talk about. And that is how it is happening with us as sex workers. Our representative, who is Rosemary Kasiba, even today in the meeting, they were deciding on some sites which needed extra SRs. And they had chosen INGO organizations. And she stood up and said, I'm not going to endorse this because I feel like communities should be given an opportunity to implement this work as well. And that is the negotiation that happened. It has been taken back to the TRP again today so that they can be able to make a decision. I think as a community, we need to understand when we are going to such spaces or we are owning such spaces, how are we articulating our issues? How are we putting them on the table so that they can be able to be addressed? Today in Kenya, we have sex workers-led organizations that are implementing Global Fund, that are running drop-in centers and giving health services to their fellow sex workers. Today, we have sex workers-led organizations who are running the human rights grants. We are not yet there. I think the fight is still there, and we need to fight more because every day more challenges are coming out when it comes to Global Fund. Because there's that other party that feels like they have more rights than us, key population. In this fight in Kenya, we are all together as key population. This time, you're going to hold each other hands when it comes to NFR4. We make sure that none of the key populations are left behind. We are all working in the same journey for as long as our issues are well articulated at the writing level. We had a meeting with our PR last week, all the key population plus the people who are using drugs, and we had clear negotiations and understanding. And we told them where the gaps are and where we need to see them filling in those gaps and how we want to see the gaps being filled in. This is the time for us to bargain for our power and our space. But Global Fund is a very political space when it comes into our countries, but it is a space that we can penetrate as a community and benefit as well. Thank you so much.
Thank you so much, Alistair. This is a really powerful message, and really thank you for joining our webinar. I'm really glad to, have this conversation involving more communities and having a really more joint effort into this process. And yeah, it's very inspirational. Thanks so much. I will now pass over to our next community speaker from Indonesia, Andy Muda from PKNI, the national coordinator. Andy, please welcome. I will now share your presentation on the screen. Andy, are you here? If you can, please unmute yourself. Looks like we're having a slight technical problem, or Andy, I can see you. Can you unmute yourself?
Yeah.
Okay, great.
Okay.
Hi.
Sorry.
The signal, Pakor.
Okay, thank you everyone. First, I'm so sorry my English is not good, but I can try to explain my experience, my my group involved in NFM engage NFM. In this topic is NFM4, how people who use drug can meaningfully engage. Next slide, Gaya. Experience persaudaraan korban nafsa Indonesia or PKNI for engaging with Global Fund and NFM process is during the preparation of the C19RM proposal. PKNI was only involved in several meetings. I think led by the Positive Indonesia Network, JIP, and all key populasi key network in Indonesia, dari PKNI, Indonesia Drug Use Network, GWL-INA, Men Who Sex Men Indonesia Network, IP, Indonesia Positive Woman Network, OPSI, Sex Worker Indonesia Network, JTID is Transgender Indonesia Network, Inti Muda, Young Gay Indonesia Network. In the process, PKNI produce input 10 point based on 4 thematic strategy. At the time, PKNI was very optimistic, but in reality, and Indonesia did not get the grant assistance at all. I think was the mandatory annex only the complement to the proposal list for the formality of the complete of the proposal, or our input was not included in the C90RM proposal, because in our country the Global Fund grant are very political. Next slide. What we improve the process of community involved and the participation in the NFM. First, where the key population network come together, education and awareness within key population network increase as does legitimacy. This is a particularly powerful for drug user-led network, who often struggle to be seen as legitimate by policymakers. Number 2 is COVID-19 presented an opportunity across many countries to work together as group of key population with CCM to ensure prevention and treatment was continued to the community of people who use drugs. Number 3, stronger drug user network are based on the foundation of strong organization, advocacy, leadership, and legitimacy. And number 4, recognizing people who use drugs as expert and professionals should be a key of Global Fund strategy to ensure resources are effectively allocated to address the need of people who use drugs, ideally through separate funding stream. Next slide. What is experience engaging in development of community annex as a part of CR90RM 2.0? Until now, PKNI not involved for consultation for the develop of the community annex as a part of C90RM 2.0, because we don't have opportunity, we don't have anything in our country. Our organization is closed by another organization. I don't know why, but that's the reality. There is even one SSR, global fund, that conduct PIWIT outreach in Greater Jakarta in HCT, which require to be field officer to be clean for drug at least 2 years. Why, man? It's far away from human right. How we people who use drug can make opportunity to work. Oh, is not make sense for me. Obviously, this from stigma and discrimination for people who use drug. How the field officer can be enter the PIWIT environment, the circle of people injecting drugs, because they're not asked how that field officer can enter the circle. He can provide the data to global fund. Even getting sterile syringe is very difficult in Indonesia, because the policy for sterile syringe can only be accessed at the health center, and makes PIWIT afraid to access, because is an entity number must be recorded in health center. I'm people with injection drugs, and I'm scared to access the clean needle in healthcare, district healthcare, puskesmas in Indonesia, puskesmas, because my ID is recorded by puskesmas. Sterile syringe now is available, but far away below standard, is easy to broken. I don't know why. I think full participation and membership of CCM remain a key challenge for a drug user-led network across the Indonesia. Well, some countries have made significant progress. Others are still far away from this. Indonesia still far away from this.
Andy, I'm so sorry. Can you please wrap it up?
Yeah.
Thank you. Just yeah, you can please just finalize the presentation for 1 more minute. We're just running over time.
Okay.
Thank
Okay.
you.
There is much diversity across region of a country. Common challenge for network people who use drug is capacity established and legally registered organization. Structural barrier to participation continue to impede progress in some country where participation of people who use drug is not welcome. Lastly, there is still a long way to go so that people who use drug representative are seen and value as the expert they are within the global fund. And this is next is the picture. Yeah, this same documentation. This is technical assistant from INPUD. Next slide. This is adaptation training tool engage in global fund process. Aditya help us to discuss to make an ID, make a engage people who use drug. And next slide. This stronger drug user-led network are based on the foundation and strong organization, advocacy, leadership, and legitimacy. Next slide is recognizing people who use drug as expert and professional should be key for global fund strategy to ensure resources and effective allocated to address the need of people who use drug. Next slide is, I think, is over. Thank you.
Thank you so much, Andy. Thank you. It's great to hear from you and hear from your experience and from the experience in Indonesia. Really appreciate your inputs and sharing with all of us. And now our final presentation is from UNAIDS, from Adriana Jimenez Cuen. Please welcome, who will talk about UNAIDS' role and support in NFM process.
Thank you, Gaia, and hello, everyone. My name is Adriana Jimenez Cuen, and I work at the UNAIDS Global Center. So I'm just here to show you a few slides about the support from UNAIDS. We've had experience providing technical support in previous rounds, so now we would like to share with you our plans for technical support for the next NFM4. Thank you, Gaia. Thank you. So basically what I'm going to be telling you about is some of the key changes that we should take into account for NFM4. I'll be sharing some learnings from past experience, as I said, and also our proposal for the next round of applications. I'll share with you also some examples that we had from the previous NFM3, and also a few examples and tips, how we can improve, for the next round of applications. Next, please. So in terms of the key changes, what is at stake really? If we are to achieve our ambitious global 2025 targets, people who use drugs need to be meaningfully engaged in the global fund programs and processes at all different levels. So what I'm showing here, very quickly is of course our new 2025 targets, very ambitious, the 95, 95, 95. But very specifically, we have new targets such as the 10, 10, 10, looking at stigma discrimination, gender equality, removing punitive laws. But also, we have very detailed prevention targets, and particularly for key populations. So listed there on the right-hand side, you have our detailed targets for people who use drugs. Very ambitious, all of them, considering where we are right now. But also our community-led response targets, they're also very ambitious. 30% of testing and treatment services to be delivered by community-led organizations. 80% of service delivery for HIV prevention programs for key populations and women to be delivered by community, key population, and women-led organizations. And 60% of the program supporting the achievement of societal enablers to be delivered by community-led organizations. So these are all, very ambitious targets, and we feel that we really have to make the best, to make sure that we increase, the achievement of these targets with the new opportunity of the next round of Global Fund applications. So the next slide, shows a little bit, why we think, that is important. As many of you perhaps are aware, UNAIDS released in Montreal during the AIDS 2022 conference a new Global AIDS update report. And you can see there on the screen, in danger. Yeah, definitely in danger, because we're actually seeing that AIDS responses are slowing in many countries. And in fact, last year, we saw the smallest annual reduction in the number of new HIV infections since 2016. So we know that we have 3 regions, such as Eastern Europe and Central Asia, Middle East, and North Africa, Latin America that have seen increases in annual HIV infections over multiple years. But now we're also seeing Asia and the Pacific showing rising new infections. So in this report, you see plenty of examples. We show how large portion of Eastern Europe and Central Asia still don't have harm reduction services that are so much needed to turn the tide of epidemics. So in the next slide, I would like to show you a little bit the lessons that we learned providing technical support for NFM3. So actually for NFM3, UNAIDS provided technical support to 82% of countries applying for HIV or submitting HIV joint applications. We also provided some sort of a mechanism of reviewing virtually draft funding requests. So around 46 countries actually benefited from that. In the middle, you can actually see the composition of our team of increasingly local consultants in 3 regions, WCA, Eastern and Southern Africa, and Asia Pacific. And you can see there how we provided a lot of support to secure community engagement and to work on community systems. 40% of all the assignments were covered in that particular area. And a big emphasis as well in NFM3 was to provide support to address human rights and gender related programming. So 44% of the assignments. So actually we have quite a number of lessons learned for every single assignment, and every window of application. We actually carried out several surveys about, with the country stakeholders and people involved in those assignments. So what we have actually learned is that regular learning events, public webinars are a good tool, and we're going to continue doing that. The virtual review of funding requests was also very much appreciated. But we also learned that we were not doing so well supporting countries with their prioritization processes. I think, as many of the colleagues mentioned earlier, at a time of decision making, sometimes it's more the political dynamics that have much of an impact on what gets to be included in the funding request. So that's something that we learned that we want to improve on. So we also learned that we have to continue supporting local consultants. We also introduced in the last cycle a virtual team of specialists working virtually and providing coaching or providing training, or just being linked also to local teams. And lastly, another big lesson learned was that it doesn't matter sometimes how many consultants you provide or how much technical support you provide, virtually, online, but really big shifts are really require the advocacy, with decision makers, really in-person meetings and in-person discussions. So the next slide, shows you a little bit what we're thinking about in terms of technical support for NFM4. If we can show the next slide, please. Thank you. So of course, our goal is to make sure that we support countries submitting high quality evidence-based global fund funding requests aligned with the new global AIDS and global fund strategies and in line with the new global targets. So of course, we'll continue providing technical assistance at country level. We'll continue having our virtual technical support team, which, as I said, is a group of technical experts that can be providing technical support as requested from country stakeholders and writing teams, CCMs. We'll also continue with our regular learning events, advocacy opportunities. We're actually planning a number of in-person meetings in certain regions. And we'll continue also providing the technical review of draft global fund applications if country stakeholders are interested, for an independent and neutral group of experts to review and provide comments. So the next slide, I show you a little bit in terms of the areas that we are pushing in line, of course, with the new global AIDS strategy and the new global AIDS targets. So we call this a 3+1 approach, and for us, in the past we were mainly advocating and focusing on the development of national strategic plans and program reviews as a preparation for having a well-prioritized global fund application. This time around, we're actually recommending countries to look at HIV prevention national roadmaps. We have a new Global Prevention Coalition roadmap, so we have a new tool that we can use for the next cycle. And lastly, we're putting a lot of emphasis on continuing the provision and including in Global Fund applications differentiated service delivery, and of course increasing the scope, the scale of community-led responses, right? So the next slide, I can show you a little bit what it looks like in practice. So as I said, I'm trying to highlight here some of the specific support that UNAIDS can offer to the community to facilitate and streamline the inclusion of people who use drugs in NFM4 processes. So as I said before, we don't start necessarily with the Global Fund funding request development, but we actually start a little bit earlier with the development of what we call building blocks. That's the National Strategic Plan, prevention roadmaps, stigma index, gender assessments, etc. So for the actual development of these building blocks, UNAIDS can provide technical assistance in the form of consultants. It can also provide support for community engagement, also through local consultants. So just bear that in mind, because we think it's very important for us in preparation for a new Global Fund application. Then, of course, during the actual development of a funding request, we can also provide technical assistance in consultants. We can also provide support for community engagement consultants. We have, as I said before, this virtual help desk, this team of experts that can provide support online. We also have regional trainings, hybrid. Some of them perhaps would allow for online and in-person participation, and for those we're going to be sharing with the different networks and civil society networks as well in the regions. We also have the mock TRP meetings. That's basically some of hybrid meetings where country stakeholders come with their draft applications just to exchange with other country delegations and to also learn from those exchanges. And we'll continue, of course, with the virtual review of draft funding requests. Of course, our technical support doesn't stop there. We provide technical support as well for grant making and for TRP clarifications processes, again, with consultants, community engagement, the virtual help desk as well. And also during implementation, which is actually quite important, because sometimes we see that many of the interventions that actually make it in the funding request sometimes are not implemented on time, or not all the funding actually gets to be used. So also UNAIDS can provide technical support for the rollout of new interventions, new harm reduction programs, new interventions, with the communities, capacity strengthening of community-led organizations implementing Global Fund activities. So in the pictures there, you have some of the events we had in the last NFM3. And the next slide.
Adriana, can you wrap it up with
Yes,
1 minute?
I'm going to wrap up. Yeah,
Thank you.
Thanks
so much.
Last couple of slides. So very quickly, the next slide, I can show you, and you can just look at this when you have time, the list of countries that are eligible for that technical support, and you can contact your UNAIDS country office. And the next slide is just to reiterate, the different, it's very important, engaging in a funding request before, to know your data, and of course UNAIDS has their multiple, tools that you can use for that. But also, just before engaging in the development of a funding request, to actually ask principal recipients and sub-recipients, show us, how many of the interventions, the activities we planned that were included in the last funding request were actually implemented, right? So let's start from the lessons learned, and let's start from, how we did in NFM3. I mentioned a lot of, the different kind of technical support we provide during the development of a funding request, and actually when decisions are being made, for that meaningful engagement in CCM processes and decision making. Bear in mind that UNAIDS, my UNAIDS colleagues in country offices are also members of CCMs, in over 75 countries. So you can also reach out to them. And very lastly, I wanted just to highlight that we have a very good new technical guidance, which is the new WHO Key Population Consolidated Guidelines, that you can actually use during the prioritization discussions at the CCM and with the writing teams, which is the last slide that I included in this slide deck, which you can have it and you can refer to it and you can reach out with any question that you may have. Thank you. Back to you.
Thank you so much, Adriana. Very, very helpful presentation indeed. I hope that everyone also enjoyed it, and we will of course share all the slides. I think it was a lot of very useful information from all our speakers. Now I will hand over to my co-moderator, Aditya Taslim, who will also help me with the questions to our speakers. And I encourage everyone to post their questions in the chat box that we will do right after we'll challenge our speakers. Aditya?
Thank you, Gaia. Thank you, everyone, for the presentation. And I'll probably begin with the first presenter, Gavin. Good to see you again after seeing you like a couple of weeks ago, is it? But yeah, just Gavin, just on the Global Fund side, I know, I mean, Andy and Felista also gave us a reality check on the ground, like, things that are written are not always what we see on the ground. So, and this is often experienced by criminalized populations, like people who use drugs. And the question is really about, how can Global Fund and other actors like the country team, the funding portfolio manager, including UN partners, play a role in terms of when a relationship between community of people who use drugs are not established with the CCM or excluded or even sidelined, or as Andy said, that participation is very limited only to those who are not using drugs, and also that's my first question, and I also have another question to you, Gavin, and probably David, because Gavin, you mentioned you started the presentation with the strategy putting more emphasis on community at the center, leadership of the community, as well as engagement. And we know also from experience, engagement of community have increased, particularly from lessons from the C19RM. However, how can we ensure that this does not only end up as a checklist, and also that we make sure that this engagement is continuously measured, not beyond the application process, but also during the implementation, as well as midterm evaluation and all the other processes.
Thanks, Aditya, and good to see you again. So, I mean, you're right. The theory and the guidance is exactly that. It's guidance and it's words on paper. The crux of the matter is how that actually plays out in country. And I think Felicita and Andy have already really grounded us in some of the reality. And in terms of how we ensure that guidance is followed, I think it comes to something that Felicita said, that is that you have power. You do have power in terms of the representatives that need to sign off on funding requests, that there needs to be a narrative around what the community engagement was like. So we need a narrative annex around the community engagement. We're going to have a community annex, which I know that we could have a conversation around, but I think it's about utilizing those tools. But really importantly, it's about speaking out. If you're not being engaged, not to wait until the end of the process, until the funding request has been submitted or the grant is signed, and then saying we weren't included. But it's about being really in the moment and reaching out. If you don't know who to reach out to, you know, I would say people on this call reaching out to INPUD to flag with us so that we can flag with country teams and the CCM hub to try and address it in real time. You've also got Adriana and our colleagues from UNAIDS, and I think it's about asking those partners on the ground to really become involved and to demand that they use their voice. You know, I sit here, well, actually, like Adriana, we sit here in Geneva, and it's important to use the partners that have country presence also to ensure that there's meaningful engagement. And I think that it's also about how I started in terms of who the allies are, who are the people that have, you know, have experience, because we've, you know, we're not starting from ground zero. We've had previous experiences. We have a sense of who our allies are and who those that might be more resistant. So I think it's about engaging really proactively. It's about using our voice. It's about making sure that in this period ahead, we're going to network really hard. And I do think that there will be, through minimum engagement expectations, there will be more points that allow transparency around what is being included in the funding request, and as that goes through grant making. It's not going to be ideal, and there will be, you know, others that will seek to deprioritize what the community wants to see. So I think it's our collective vigilance around that.
Yeah, maybe just to add two quick things. One is really hear Andy's point that it's possible to be formally included, but practically excluded from these processes. So there are a lot of times when the CCM will include someone who injects drugs, for example, but that person is sitting silently while the Deputy Minister of Health decides everything that goes in the application. But to Gavin's point, really understanding beforehand what resources are available to support people who are representing the community. So for example, I can think of a lot of times when, say, the country dialogue will announce that it's being held one day before and people haven't had time or money to get from the place where they live to the consultation because they didn't even know it was going to be happening and they don't know that there's that 15% resources to support them. So really starting the process of signaling to the people who are centrally engaged in the country dialogue and in the CCM process that you're there and you have something to say before the news of the country dialogue being announced, very, very important. And then secondly, going again to Andy's point that, for example, people are afraid to go to the community health center to get a needle because they don't want to give their ID. That is a very concrete HIV programming connected point. And the reality is that programming for people who inject drugs won't work if people are afraid to use it. But I think a lot of times the discussion ends up being more about political fighting between groups about who's included and not always connected to the HIV programming point. So really important to emphasize that people who use drugs need to be included because otherwise the HIV programming won't reach people effectively. So wherever you can link it to concrete HIV related outcomes, very, very useful and important. But I completely agree that it's an ongoing process and that starting early and recognizing that UNAIDS colleagues, for example, so central to putting together the application. So, you know, we at the Global Fund and UNAIDS don't even necessarily keep track of all the new guidance and things that are coming out. There's so much. So it's also on us at the Global Fund, for example, to educate our country team colleagues and our UNAIDS colleagues and things on some of the new developments, because so much material, very hard for people to even know that policies have changed or that there is new guidance on something like harm reduction. And last thing I'll say is that there will be a harm reduction technical brief that's now being finalized. We'll make sure to circulate it to INPUD, but also, Adriana, if we could rely on you also to make sure that it finds its way to the UNAIDS country focal points who are helping. Yeah, there's so much information. We need to make some concerted effort if we're going to make change.
Thanks, Daniel. That was exactly quite a nice bridge to my next question for Adriana. Adriana, you mentioned the kind of support and role that UNAIDS can take and in the NFM4 especially. I mean, we always see UNAIDS as our key champion in terms of meaningful engagement of a community and also key population. But we also understand that UNAIDS, the level of presence of country office in different countries are very different. Some countries have very high level of presence with strong leadership in all these processes. But we also understand that there are countries that have very little presence, and the reality is that not all networks or organizations led by people who use drugs have that relationship with UNAIDS, and often this kind of support that they need to be engaged is it's either inaccessible or not available. And being engaged is not only, being present. Like, you need some resources, as Daniel mentioned, and this kind of support that is required. So the question would be on how to make sure that, regardless of the level of presence, what can UNAIDS and possibly the other UN co-sponsors support that can really help communities of people who use drugs who are often sidelined and excluded.
Thank you. That's a very good question, and definitely, you were pointing out, very well. We've had, challenges, of course, in terms of our country presence, and right now, of course, there are offices, as you were saying, have more members than others, right? But the technical support that I was presenting here today is actually, from global initiative. So that technical support can be accessed if, of course, there is the countries in the list of eligible countries can be accessed from a UNAIDS country office. So that support comes with our technical support mechanism, which is a mechanism that is centrally managed, country-led. So it's at the request of country stakeholders, and country stakeholders can be, communities, like, of course, people who use drugs, or any kind of key population network, community, etc., or CCM, or principal recipients, etc., requested at country level, and then it comes, to us, so to say, for that kind of provision of technical support, which is usually through local consultants, right? I mean, our first kind of response is going to be, okay, so do we have consultants at country level that can actually provide that kind of support, whether it's something technical, whether it is for community engagement, etc. But at the same time, I was trying to present on other kind of support, because we know that sometimes at country level, the situation can be pretty, difficult, challenging, very political, right? And sometimes, for the communities, for the different networks, it's difficult to, push for scaling up programs, for sex workers or harm reduction, or introduce new interventions. It's hard because perhaps you don't have that enabling environment, right? Or you don't have, supporters at CCM, or, so for that, we have this other kind of support, which is, I always mention the virtual review of draft applications, because that what normally happens is that those drafts are reviewed by global or regional experts, neutral, independent, from UNAIDS, WHO, and other technical partners. And when we provide comments, those comments are going to be in line with the latest, guidance, global guidance. So of course, we're going to be citing, the documents I was presenting today. So in a way, I was trying to show the example of Pakistan, a challenging, environment, as we all know, where, through that kind of process, we were able to point out all the gaps and weaknesses that they had around their programs for people who use drugs, for introducing some of the, OST and other, elements of those programs. So by the way, in which is set up, which is international outside the country, is a way to push, another level of advocacy, right? That goes directly to CCMs, that goes directly to government stakeholders. So that's why I always recommend, to ask for this kind of, virtual review, because you would have another voice that comes from outside, the country, and that can be also quite impactful. But at the same time, regardless of our level of country presence, in many of the countries where we operate, we are always part of the CCM, either as members or, as members of the different, committees. And you should be able to find an ally, in those colleagues that, will actually, help you to amplify, your voices, right? Or to point you to other kind of available support. If it's not through UNAIDS, they would find out, or they will, know if there are any kind of other opportunities for technical support. As I said, our support, I try to present it as best as possible, but if sometimes we don't have sufficient funding, or we cannot provide support in a particular country, we can always, point out to other technical partners, to help out.
Thanks, Adriana. Gaia, over to you.
Yes, thank you so much. So I will now would like to ask a question to our community speakers, to Falister. Falister, I was wondering if you could share your advice about building coalitions between the key populations to advocate together. In your intervention, you recently shared that you really were able to come together with other community representatives and able to advocate for the priorities to be included in the funding requests. Could you share your key advice with us on this?
Yes. I'm sorry, my Wi-Fi is a bit shaky. So
No
yes, I think one of the things that we need to realize is the power within, the kind of powers that we have. As key population, if we work together, there's nothing that we cannot change. And I've seen that through the Key Population Consortium of Kenya. We as the key population of Kenya, we were not involved in anything. We were the less privileged people, but we had to identify the powers that we have as key populations. And that was for us to come together and form the Key Population Consortium. From then, our conversations and our discussions started coming out as one voice. When we are going into writing team, we choose our writing representative as the key population. In the CCMs, our representatives are coming in as key population. And when we are writing a protest letter, it is coming out as one letter from the Key Population Consortium of Kenya. And that holds a very strong voice, a very strong move that nobody can be able to refuse, because they used to use a divide and rule power. They used to maybe use MSM come against sex workers. Maybe PWD come and say no to what another key population organization has said. But right now, the divide and rule power, it's not there, because we have shut the doors. Our governments are using divide and rule. And if we are not careful as key population to come together and work together, then, and the space is shrinking at the same time, money is going away. So this is the time for us to come together and fight for the little money that is left, so that we can be able to make the change that we want to see within our communities. So I think that's the only thing I'll say. Just let's come together. We don't have to be friends. We don't have to love each other. But what we need to do is walk the walk and walk the talk together. That is the only thing that we need. Let's work together as key populations.
Thank you so much, Fausto, really. Yeah, very practical advice, thanks. And Andy, also one question to you, and we can also link it to Gavin's question in the chat box. So Andy, based on your experience, previous experience in the Global Fund and NFM processes, what do you think can and should be improved in the process of community involvement and participation in NFM? And Gavin was asking also what really didn't work well last time around with the community annex, and why do you think that happened? So just based on your experience, like why it didn't work out, and what do you suggest would be good to, you know, improve moving forward?
Yeah, thank you, Gaia. I think the key is more people who use drug, an expert and professional involved in this program. I mean not the academic, or let give our community chance to address the need of people who use drugs. That's the key, I think, because the in one province in Indonesia, I think Sulawesi province, there is some organization, professional organization, can be SSR or SR. I don't remember. SSR, I think. How we linkage with the Adriana explain 80% prevention lead by peers, 30% treatment lead by peers, or some kind like that, is far away from us. That opportunity is a little for us. So improving or from invisible to influence, I read the input, from invisible to influence people who use drug is very useful to NFM. I think is my answer, Gaia. Thank you.
Thank you so much, Andy. Thanks. So now we have a little bit of time left for our questions from the audience, and I see that there was quite an intensive chat, and some questions have been already answered by our speakers. So maybe first I will let Ahmed, who is raising his hand, to ask his question, and then see if anything else has been not addressed. Ahmed, can you unmute yourself?
Yes. Thank you so much. Thank you for seeing that hand. First, I want to say thank you so much for bringing in this conversation, because it's very, very important. And as a person who uses drugs and a community member in Kenya, I'll be specific to harm reduction program. because when you come to Kenya right now, harm reduction program is mainstream heavy. It is the mainstream organization that do implement harm reduction program. And even you see at now we are having, it's good we are talking about NFM4, but if you look at the NFM3, as Felista has put it, the writing team that was constituted was heavily people from the community of the people who use drugs, the sex work community, the trans community. But now when it comes to implementation, the consideration was highly prioritized to the mainstream organization based on their capacity and all that. Now that is gone, but now we are asking, my question is, as a person seated at the CCM and all that, having this community behind you, expecting a lot from you, to deliver a lot from you, what are the mechanisms we can apply right now in the coming writing that the harm reduction program will be equally and will be like having community heavy rather than mainstream heavy the way we are having it right now. The second thing that I would like to ask is about in that writing process, because now we normally have several meetings, several meetings. I don't know how INPUD and the organizers that now you are briefing us from the leadership level, how can we mainstream other support to the member who are not able to join? Because most of the meeting at that moment were done online, and most of the people struggle actually to get bundles to join that meeting. And even if it will be done also physically, you'll find that a person who stays at the coast region of Kenya like me will be very difficult to go to the gathering in Nairobi. So I'm asking at that point, whenever we come up with we've constituted a writing team from the key population of the the people who use drugs, how are we going to have that mutual support to ensure that the things that we are saying, we are sure whatever is submitted is what we agree? Because Kenya also has expert of shortchanging documents. Once you agreed on a certain document, you see another thing that has been submitted. So how do we also put that spot check in every detail that will be submitted in the country proposal? Thank you, Andra. Over to you. Yeah.
I would like to invite both Global Fund and UNAIDS to see if they would like to answer to these questions from Ahmed. Whoever would like to start. Gavin,
perhaps I can jump in and say, Ahmed, you know, it's really clear that this happens too often, that community engagement is often better during country dialogue, funding request development. As we get closer to finalization, engagement drops off. And then there's this, you know, blackout period in grant making. So what we are wanting to do is to make sure that there's a community annex so that we've got visibility and there's transparency on what's at the highest priority interventions were from community, that these can be tracked by Secretariat, and we can have an understanding of if there were community priorities that delivering value and aligned with guidance, why they haven't been included. And there will be, as I said, minimum expectations on community engagement that will include opportunities for the CCM to exercise its oversight during grant making. Now, the trick with that will be to make sure that the community and key population representatives are involved in that process. Communication will go out to all CCM members around it, but we need to make sure that we are vigilant over that. And I think simply using, this is not just what communities are asking for. This is, as Adriana has explained, this is in the UNAIDS strategy. And as Daniel has explained, where we have in our Global Fund guidance as well. It's not just communities that are calling for this, it's what's in the guidance as well and what we know works. So there isn't a perfect solution, but I think it's about continually following through and making sure that the country dialogue runs through grant making, and country dialogue runs through grant design and development. Thanks.
Unless anyone else wants to add to Gavin, I can then, yeah.
Can I add very quickly?
Yeah, sure.
I think, it's very important to remember that implementation arrangement discussions now happen at the very start, as well, because of course that information has to be submitted with the Global Fund request. So for us, and that's why I was emphasizing our new community-led, response targets. For us, it's important to make sure that where it makes sense, we're increasing the scope of community-led organizations that provide, services. And of course, it can be country-specific. And of course, you can be looking at the latest evidence and latest, best practices, examples. But that's a discussion that needs to happen already with the development of the funding request, of the prioritization of, what kind of interventions should be there. Because it's not about the interventions, it's not just about the what, but also the how. So I think that's, when you articulate, your voice, your advocacy, you can also mention, okay, this is the what, right? The interventions that will go in the funding request. But, for these interventions to be impactful, our communities would actually need to be delivered in such and such way, right? Community models, virtual platforms, we have an array of delivery models that we know that actually work. And that's where, our community-led response targets actually sit. So to have a conversation about the what and to have a conversation about the how, if possible, together, I think that's actually quite important during the development of the funding request. But also, as Gavin was mentioning, grant making is a very, very important phase. And many of our communities and stakeholders, they are involved, up to the submission of the funding request, and it gets approved and it's great, but it's not over, it's not over until it's over. You have to continue being engaged and continue providing that oversight during the grant making. Efficiencies, savings can be found, things can change. You have to be there, at the table to make sure that actually when the grant is signed, those interventions that you've been fighting for, they're actually there, the what and the how. So that's all from my side. Thank you.
Thank you so much, Adriana and Gavin. We're running out of time, but we want to let our audience also ask additional questions. I see raised hand from Charan and from Bonnie. Bonnie, if you can just let Charan first speak. He goes first. I'll definitely answer your question afterwards. Charan.
Okay.
Yeah. Thank you for the opportunity, and sorry about the video. So two quick questions, as well as we would need suggestions as well as recommendation. We have heard about programs that we could propose for viral hepatitis. We could propose for rights violation. We could propose for the comprehensive harm reduction program. But unfortunately, in India, these three programs that we've just talked about falls under different departments or different ministries. The needle syringe and the OST methadone falls under the National AIDS Control Organization. Hepatitis falls under National Viral Hepatitis Program. The violation that happens in the rehab center, people are being tortured, people dying inside rehab centers and beaten up. That comes under a different ministry at all. That comes under the Ministry of Social Justice and Empowerment. So will Global Fund will be able to play a role over there of kind of bringing this organization or this departments together to address this? And the second quick question, I won't take much time because there are also other people who would like to raise the question, is the drug trends are changing very, very quickly, and particularly in the Northeast, there is a new form of heroin. It's actually not a heroin; it's a mixture of a very low-grade heroin with a little bit of brown sugar and some chemicals. So when people use it, we tend to go crazy for about 45 to 1 hour. So I'm talking this from my experience because I've used that for a couple of times. It's not like the earlier heroin. So it's not about my experience, but then the population that's been using this is the younger generation, 12, 13, 14, 15, who are still in school, who are like, kind of graduating from school and going to higher secondary school. So when we talk about addressing community needs, I really feel that we are actually not addressing the needs of this population. So we need to seriously think about how do we address and how do we design this program and how do we ensure that this group of community who are of younger generation are brought into the our program implementation. Yeah, thank you.
Maybe I'll jump in on some of the points. Look, the guidance from the Global Fund will also ask countries to include an assessment of the changing policy environment and circumstances of drug use, etc. And it doesn't need to be a complete national biobehavioral surveillance effort with an exact number of drug users, etc. Even some rapid assessment or information, for example, about what's happening in the Northeast would show that that people aren't just phoning in their standard requests, but actually responding to changing environment. So the technical review panel will prioritize applications that actually have engaged in that. So I think it's a really important point. Like the drug markets don't stay the same, drug use doesn't stay the same, and the programs shouldn't just stay the same. Gavin may have more on your question about the different stakeholders, but I will say that the idea of the CCM was always that it would unite multiple different sectors and stakeholders and get beyond just a single, for example, the National AIDS Control Program or law enforcement or whatever. But I recognize that that's really easy to say and actually hard to implement. It would probably be useful, again, for if UNAIDS is a key partner in putting together the application, to flag this for them earlier, and also and perhaps we at CRG could help do this, to flag for the country team that there are these multiple actors. But it's a really good question, and I don't think there's a simple answer, except that the CCM process is not supposed to be sector specific, but is supposed to be countrywide. I think if people felt like there was some money or support for reforms that could come from the Global Fund process, they'd be more likely to engage. And I know that that's really the political question at the heart of it all, is what do people get out of their engagement, and is it worth their time, etc. Over.
Thank you so much, Daniel and Gavin. And we'll take one last question from Bonnie. Bonnie, please speak. You can ask now.
Okay, test. Can you hear my sound?
Yes.
Okay. Good evening, everyone. Izin Pak Ornas. Okay, I think in more 20 years, harm reduction program in my country, not more better. Right now, the Global Fund just focus to VCT, I think. And the community did not access for NHP program like IEC, mobile harm reduction, hepatitis C referral system to help access from community involvement just lip service from the stakeholder, FAC country PR. We have worked on the issue of mental health in people use drugs, which is not the focus on the GF and the government. Increase knowledge about HIV, harm reduction, health service, and mental health issue for PBUM. Accessing PBUM community to rehabilitation and social protection program involving indigenous people to the program from planning implementation until monitoring and evaluation. Thank you. This is my statement. I'm sorry, maybe more emotional about, I think right now we just need a more different program for people who use drugs. Not just VCT outreach program. I think further outreach program. We need evaluation and monitoring the global fund. The global fund in Indonesia for the outreach program. Yeah, because in my country right now, maybe 80% people who injecting drugs already VCT. Yeah, I'm sorry, Gaya, if I sound more emotional. Thank you, everyone, for listening. Can you understand my speaking?
Yeah, no,
I
thank
hope-
you.
I hope-
Absolutely.
I hope-
No. Yes,
hope,
yes,
yeah.
we
Okay.
understand. We
Okay.
really appreciate your honesty, and I think
Yeah,
it's
yeah.
great that we come here together for such an important discussion.
Yeah. Hi, Gaya. You from? Where do you from? Yeah. Okay, Gaya. Yeah.
Thank you so much, Bonnie.
Gaya,
Thanks
thank you.
all the questions, and we're running out of time. And I really just want to thank everyone for fantastic presentations and inputs. And just wanna, since Judy unfortunately had to drop off, I will take the closing remarks on her behalf and apologize for that. But also just want to thank again everyone for joining. And I want to really encourage every single participant today to really be vigilant and to really make sure that if anything goes wrong and if you are not included in the process, please reach out to INPUD, please reach out to the Global Fund, to UNAIDS, and make your voice clear, be loud and speak out, and don't be afraid of anything, because we all need to know what's happening. We don't want to do another business as usual. We really want to make sure that this time we have to change and not reinvent the wheel and not do things as we did before, because communities are indeed not just in the center of the strategy on paper. We want to put that in action. Thank you so much. Thanks for all the comments and really great discussion. And if you would like to take a group photo, please put your cameras on. I'll ask my colleague Jake to take a screenshot.
All right, everyone. Yep, if you want to be in the photo, please turn your camera on now. Give everyone a moment here. Quite a lot of people, so I'll see if I can get everyone in one shot. Otherwise, I may have to do two pages, which is good. Two. Ready? Okay, everyone smile. 3, 2, 1. Oh, I'm sorry. That did not work. What's going on? Sorry, just
More
okay.
smile.
I apologize. All right. 1, 2, 3, smiles.
Cheese.
There we go. Thank you, everyone.
Thanks, everyone. It was great to see and talk to you all. And we'll absolutely share everything right after this presentation. Thanks so much and have a great rest of the day.
Thanks, Gaia.
Thanks.
Okay.
All right.
Thanks for
Bye.
Indonesia, yeah.
Thanks, everyone.
Thanks.
Bye.
Bye.
Thank you, everyone. Bye-bye.